This is a patient who has an ingrowing toenail of the hallux, but on both sides. These we do under a ring block, and in the ring block I use Marcaine mixed with lignocaine, all plain, no adrenaline. Now we exsanguinate the toe so that there is no bleeding at all during the procedure. It enables us to see the edges well, to see germinal matrix, all the borders of the germinal matrix, so that we can remove it completely. We clean the edges thoroughly. There's sometimes granulation tissue, and we raise the nail fold off the nail. Then we cut the nail. If the nail is very thick, you may need shears to cut it, but here the 15 blade is cutting it. So we cut the toenail, but we come back beyond the nail to see the very base of the germinal matrix, so that we remove the entire nail or the affected portion of nail and the germinal matrix, which grows from beyond the proximal nail fold. And here we remove the nail by just getting an artery forceps under it, remove it in its entirety. It's a bloodless plane. And then we look, that's the germinal matrix we can see there, and we excise it completely. We have to go right at the lateral margin or the edge of the nail there and go wide. We have to be sure that this is the commonest error, not to go wide enough laterally and get the entire width of the germinal matrix, and then also to go proximal enough right down to bone, to the phalanx, so that the entire germinal matrix is removed. That way we ensure that that risk of recurrence, which often occurs in the lateralmost portion, that the germinal matrix is completely removed. This can all be done, as you see, with sharp dissection, and we don't have to rely on chemical destruction, which is more unpredictable. So I like to remove the entire germinal matrix here and then suture the edges of the incision that we made. The dissection is taken very lateral and very proximal to minimize the risk of recurrence. And here you can see the width of the germinal matrix, and we close here. Choice of suture would depend on surgeon. Here I'm using Vicryl, but you can use a non-absorbable if you so wish. And the same procedure is done on the other side. The granulation tissue there is excised. The margins are clearly defined. The nail is now incised. As I say, you might use shears if it's not sharp enough. And here you have to be careful when you're exerting pressure to cut through the nail that it doesn't slide too far forward. Once more, you must raise enough of that fold to see the lateralmost margin. And here again we can see that. You can see all the edges of the germinal matrix. And here I'm extending the incision just to make sure that we reach the proximal most part of the germinal matrix, which is well below the skin, which is why you must incise the skin to do it well and to be sure you're doing it under vision. It's important to do this under tourniquet because visibility is very important here. And here the entire germinal matrix is removed from that portion of nail. For suturing, I like to use a 5/8 circle. So if you have a 3/8 circle or a half circle, then you bend it because it facilitates the suturing.